Dr. Kimmy is back with us here from St. Louis University. Thanks for coming back to the show.
My pleasure.
As a point of transparency, you were also formerly with the Missouri Health Foundation.
Correct.
You're not, and they fund a lot of the Missouri Foundation for Health. They fund some ongoing coverage of health issues here at the 9 Network, but that's not who you're speaking for tonight.
No, not at all.
So we can only blame you for the things that come out of your mouth. Can you help us out? We normally would have a doctor in the house for a show like this, and we lost our doctor to scheduling just at the last minute. So I'm curious if you, as a doctor, can tell me what are some concerns? What would a doctor say? I'm going to ask you to play a doctor on TV. What would doctors be saying in this conversation? What are you hearing from them?
Well, I think as far as the exchange is concerned,
right,
they see it as the opportunity for people who are not getting insurance and probably aren't getting medical care, getting the care they need. So I think this part of the Affordable Care Act is probably not terribly controversial with doctors.
Okay, so what is the biggest misconception about the marketplace?
I think that, I want to start with one of your tweets,
okay,
because it was really good. The fellow came on and he said, I went on the website and I looked at the prices and they were so high and I'm low income. Don't look at the sticker price. You've got to see what the subsidy would be. As I think Tim said early on, you have a subsidy if your income's between 100 and 400% of poverty in Missouri. So looking at the price that's up front doesn't really mean anything to you until you know what your subsidy is, because your subsidy can take care of almost all of that cost. So I think that guy had a really good point, and I think people are making a mistake in going to the website and looking at the spread of available plans and saying, my God, those are expensive. Well, they are expensive, but that's not the price. That's the sticker price.
So there's some work people have to do here.
There's work people have to do. There's some things they need to understand, and that's why we have the navigators, and that's why brokers can be of assistance to people. I think, there's a great deal of misunderstanding about this legislation, about this law. Kaiser Foundation did a survey last month. 65% of people have not even tried to get information about the Affordable Care Act. Now, it may be all the furor in Washington the last few days will get more people interested. What is this thing? I hope it does, because they need to start asking questions. They need to go to their website. They need to take advantage of the information that's out there, because there's something in this for an awful lot of people. There are 800,000 uninsured in Missouri. 93% probably would get subsidies if they went through the exchange.
You touched on it, but help people do this work. I mean, Apple and Google and everyone, they know we don't do work anymore, that we want things to be easy and push a button. So help people. How would you help people do that work that they're talking about? What would you suggest to get?
Well, I think that we've created the navigators, or the Act created the navigators and other kinds of assistance that will work with people to work through that website, which is fairly complex, okay? And I think that we've had the experience with Medicare. No one raised questions about this with Medicare. We've been doing navigating for Medicare patients for years in this state and other states. Somehow, because it's the Affordable Care Act, it became very controversial. And so Missouri has had difficulties getting up and running with their navigators, but they're there. And Missouri Foundation for Health is funding a lot of activity in terms of public information. The public has an opportunity here, and shame on them if they don't take advantage of it.
So are we behind in this state?
Oh, yeah. Missouri's far behind because the legislature made it impossible to create our own exchange. So we have a federal exchange coming into the state. A legislature that doesn't like federal government, big government, made it possible for the federal government, in fact, made it mandatory for the federal government to be the exchange for Missouri.
For those who will not be, this is a question we've touched on tonight, but I just want to be perfectly clear, because a lot of people watching likely have health insurance themselves already.
Mm-hmm.
Do they need to be worried about the marketplace? Will this have an impact on them?
It really has no impact on it. The marketplace has an impact on people who do have employer insurance they can't afford. If their employer has, they can go to the marketplace. If they're poor and not in Medicare and Medicaid, and they're above 100% of poverty, they can go to the marketplace. So there are people that, there are a lot of different folks that can go to the marketplace, and by going to the website, you can find out whether you're eligible or not. So you don't have to make a decision in advance, well, I'm not eligible, I'm not going to go to the website. Go to the website and find out.
Will it work?
And which part?
Will the marketplace, first back to the top of the show, how important is the marketplace to the whole law?
The marketplace is absolutely critical. So we want to cover 50, there are 50 million people that need health insurance coverage. Of them, a certain amount would be covered by expanding Medicaid, which we're not doing in Missouri, of course. Others would be covered by their employers. Others would be covered in the marketplace. The idea here is to cover as many people as possible and hopefully everybody eventually.
Okay.